For anybody who's thinking about doing this, do it. Don't even hesitate doing it, because if you're struggling to breathe and you can't walk up and down the stairs and you can't tie your shoes and you're struggling with life right now and you want to get better, Dr. Kaufman is the one to do it. And he changed my life. My name is Tom Wadera, and I'm a patient of Dr. Matthew Kaufman, who performed a phrenic nerve repair on me in June of 2020. 2 years ago, I had shoulder surgery, and in the course of my shoulder surgery, I was given a nerve block for the pain for the shoulder, and the nerve block ended up paralyzing my diaphragm. About a month or so after that surgery, I was noticing that it was really difficult for me to breathe. And I'm a soccer referee, so normally I'm in very good shape. And I was noticing that even walking up and down the stairs, I was panting. I would have to bend down and put my hands on my knees just to catch breath. Even simple tasks like walking up the stairs get me a little winded. Usually I get to the top of the flight of stairs and I have to stop to catch my breath. And I thought maybe something was going on from the surgery. Maybe I was just out of shape. But over time, things never got better. And as a matter of fact, it got even worse. So I went to my primary care doctor. I went for a sniff test. And the sniff test showed that my diaphragm not only wasn't working the way it was supposed to, it was actually going in the opposite direction. I have a daughter who's a nurse, and her and my wife were searching around for what you can do for it, and happened to stumble upon something on the internet about Dr. Kaufman. So that's how I found him. I initially had a telephone conversation with Dr. Kaufman because he was in New Jersey and I lived in Colorado at the time. So we had our initial discussion over the phone, and listening to him on the phone, he gave me a sense of peace. He said, I don't want people to go through this surgery if I don't think it's going to work. But he said, I think you're an ideal candidate for that. And he explained to me exactly what's going to happen. He said, you're going to be in a hospital for a day or so. He said, you're going to be laid up for about a week. He said, in about 2 weeks, you should be able to go back to work. In about a month, if everything works right, you should be able to start exercising again. So I decided that it's COVID or not, I'm going. And the hospital was fantastic at taking precautions to make sure. I had to do a COVID test before I flew out to New Jersey. The hotel that we stayed at was right around the corner from the hospital. So I felt very safe there. Based on the results that I felt about it, I would do it all over again. So I had the surgery, and before I had the surgery, and anybody watching this who has the same issue that I have is going to know these things. I couldn't bend over to tie my shoes. If I lean down, try to tie my shoe like this, it feels like it's pushing all the pressure out of my lungs, and I have trouble breathing, even doing simple tasks like tying my shoe. So normally I would have to stop in between each shoe, take a break, take a deep breath. These are things that didn't happen before my diaphragm was paralyzed. So I wasn't expecting a whole lot after the surgery. So I got back, I was there not even a day. I had the surgery in the morning. By 5 o'clock that afternoon, I was already heading back to my hotel room. And so I'm like, you know what, let's try a few things out. So I got to my hotel room, I bent down and I tied my shoes. That no problem, and I haven't been able to do that in years. And then my daughter and I took a walk down the hallway and up and down the stairs at the hotel. I got up 3 flights of stairs and I was breathing. I am now up to level 4, the stairs at a hotel that we're in. I'm breathing a little bit hard, but other than that, I feel pretty darn good. And I'm like, oh my God, it worked. And I knew at that moment, I knew it worked. It's been about 5 months now. I've been working with a therapist, and I've been working with this tool they call the breather that helps you work the lungs. And he said, it's just like any surgery that you have. If you don't do post-op work, it's going to be like you never did it. So he said, your diaphragm isn't going to continue to grow stronger if you don't do the work on top of it. So I do the work. I walked 12 miles at Disney World in about an 8-hour span with a mask on the entire day. And that's how I knew that, that's how I knew I'm all better. I didn't even think about breathing. I didn't think about, oh, I got to stop and sit down. And I was breathing just fine. And this past weekend, I went on a 10-mile bike ride. And it's amazing. He changed my life.